Today I'm going to talk to you about the Affordable Care Act and help you find the options that you can buy into the Affordable Care Act. Are you struggling today to pay for your prescriptions, co-payments, health insurance, and are you having to make a decision? Do I purchase food this month or do I buy my prescriptions? If you are one of those people, then you may want to hear what I have to say. There are a lot of Americans out there that are struggling to survive today because of the amount that they are paying for prescriptions, co-payments, or procedures that they need to have completed with their doctors. And they just don't realize that there is assistance that is out there and available to them. And especially in our elderly community. Our elderly community struggles every month and they just have to make that decision. Do I buy food this month or do I purchase my prescriptions? Do I go to the doctor's? Do I put gas in my car or do I pay a deductible? And I just want to let you know that out there we do have the Affordable Care Act with a ton of programs that has a bunch of assistance that's available to our elderly population and will help you get into the comfort zone of your everyday living. It is important for you to know and understand the services that we have available to us here in Colorado especially. So today I just want to talk to you about some of those services. For a long time we did not offer medical assistance to adults without children. Now, if you are an adult and you don't have a child or you are not pregnant and you need medical assistance, you can come down to your human service location and apply for medical assistance. You do not need to have any children. You do not need to be pregnant. We will offer you services. Also, we are offering a buy-in medical program. So if you have insurance and let's say that your deductible is pretty high, you can buy into Medicaid and it's very cheap. The maximum you would have to pay is $200 a month. I know with my insurance, currently I pay more than $200 a month and I'm employed through the state. So also if you were on, let's say, Social Security benefits and then you transition to a Social Security disability benefit, a lot of times if you are in one of those situations, you lose your Medicare and you have to wait 2 years to get your Medicare, which means you go 2 years without any insurance. Well, you are in between those 2 years with no insurance. When you go from SSI to SSDI, you are able to buy into Medicaid. So I know that a lot of people that end up on Social Security disability, and let's say you're under the age of 65, you need some type of insurance because you are unable to work and that's why you're receiving the Social Security disability benefit. So if you are one of those participants, then you are going to want to hear about the buy-in program. The buy-in program, we do have income guidelines, but the income guidelines are very high. It's up to 450 of the federal poverty level, and we don't include anybody else in your household. So if you have a spouse, we don't even include your spouse's income. We count your income all by itself. 450% of the federal poverty level is pretty much, you can make up to $350,000 a year and be able to buy into Medicaid. So there's a lot of room for you to grow with the Affordable Care Act and make sure that you have the coverage necessary and the coverage that you need to do your everyday living. I know that there are a lot of myths out there about the Affordable Care Act, and I would just like to maybe help you understand some of the information that's being given to you that's incorrect. So currently we are at 450,000 members that we are helping here in Colorado that's a part of the Affordable Care Act. We have been able to help a lot of children and adults and elderly people get the coverage that they need, so that way they can live without the pain, they can get the required surgeries that they may need, and have the amount of coverage that they need without having to pay out of pocket. Also, another one of the myths out there is that they say that your insurance is going to cost you a lot of money. Like I said, it's not going to cost you more than $200 a month if you buy into Medicaid. $200, like I said, I have an employer and I pay more than that per month. You are able to enroll into this Medical Assistance Affordable Care Act anytime. There's not an open enrollment period. So anytime that you would like to apply, you're able to come in and apply. It's very easy. You can also apply online through peakcolorado.com and get what you need. There are also some money that the government will assist you with. So let's say that you have to purchase a plan through a marketplace. The government will assist you with a portion of that. So let's just say that you want to go with United Healthcare and your plan costs $4,000 a year. Based on your income, the federal government will offer you assistance, and they will say, I'll pay $3,000 of the $4,000, and you will be responsible for the $1,000. And you can make payments for that $1,000, so they will divide it into 12 months and then tell you what your monthly payment is. All of that money is a tax write-off as well. So I just wanted to make sure that you know that financial assistance is out there. You are getting penalized if you do not have health insurance, but insurance is, the way that I want you to look at it is, you need car insurance if you drive a car, regardless if you're the best driver out there. Regardless if you ever have a claim, if you ever need to use that insurance, it's still the law that you have to have insurance. So it's the same thing with health insurance. You have it just in case something happens, and it really is good to have it because a medical procedure could potentially put you in bankrupt, or utilize all your savings accounts that you have if you do not have the proper insurance that you need. So I hope that you have a little bit more of a clear understanding what the Affordable Care Act has to offer, and hopefully you are able to get online and buy into the Medicaid program. If you have any additional questions, you may visit your local human service office, and they will be able to provide you any additional information that you may need.